Good morning. Good morning. Hey, Gamecock Jenny. Hey, babe. Good morning, everybody. Good morning. Woo. Yeah, I'm waking up. I do that every morning. I get myself together. Get myself together. Um, I'm waking up this morning, drinking my coffee. Now, I will say tomorrow. I don't know if I'm gonna do my live or not tomorrow at the normal time that I normally do because my son has a dentist appointment in the morning and we're gonna have to leave at a specific time. So I doubt I'm gonna be able to do my live at my exact time. So I may have to change tomorrow a little bit up. You know what I mean? But that's what happens when you got doctor's appointments. Those things happen, right? Tomorrow's a dentist appointment. It's a checkup on his teeth and all that stuff. So it's just dentist, make sure everything still look good with his teeth. I got to make his appointment for the eye doctor too. Probably gonna do that after I get off here in a little while and make sure that that's done because y'all know I be busy. I just stay busy. I swear. If I don't stay busy, I don't know what to tell you. I'm always that way. Um, but on Wellness Wednesday today, we're going to talk about a few topics today. One of them being, I'm going to teach y'all what degenerative disc disease is. And we're going to talk about like people who have to deal with massive pain all the time, right? People who have to deal with, pain every day of their life because there's also different diseases that cause that too. You don't just have degenerative disc disease, you have fibromyalgia, um, and you have a bunch of other things like some autoimmune diseases cause significant pain, like rheumatoid arthritis. You have even lupus and different things. Amputees have to go through it. Diabetics have to go through it because diabetic neuropathy is a real thing that people have to deal with. And so you have different diseases that cause pain, right? And different kinds of pain. You have people who have hip dysplasia or, connective tissue disorders. Excuse me, y'all. I had a belch. And I did take my medicine this morning. Make sure you take yours. It's your med check reminder. And so far, I haven't had that thing happen to me again since I've been doing it the way I said I was going to do it. So hopefully it don't happen again because I swear to God, if it does, I don't know how I'm going to handle that. That was like awful as hell last week. And y'all know I'm professional about my shows. And for me to have to end my whole show and it to down me all day, that was something serious for me. Now, still in the process of trying to find the two girl puppies a home. Did get the male puppy. I knew the male puppy was going to go quickly because everybody around here wants male dogs because you don't have to get them fixed, right? And so females, it is harder to find them homes because some people don't want to have to deal with that. But still doing it. Called the intake coordinator again, left her a message. Hopefully, she gets back to me very soon. Um, if not, I'll have to go up there in person and talk to them in person because I've tried twice on the phone, both times left messages, waiting on them to call me back. So if they don't, I will be going up there in person, and be like, look, I can't, I do not have the space for this situation. If I did, wouldn't be a problem. You know what I'm saying? I don't. But so this morning, we're going to be talking about some health and some wealth and situations. And I did have some people state that they did want to come over here and come up, but I don't see them in chat yet. They may pop up a few minutes into the show because some of them may have stayed up later last night, may not be awake just yet. They may be visiting somebody else's house. They may come through. I don't know. Either way it goes, we're going to continue with our show like we always do. I always have to bring in, my copyright disclaimer, even though this information is coming from a website and whatnot. I always have to bring it up to show, even though I don't think I'm playing any videos just yet. I might. So I want to go ahead and bring up my copyright disclaimer under Section 107 of the Copyright Act of 1976. Allowance is made for fair use for purposes such as criticism, comment, news reporting, scholarship, and research. Fair use is use permitted to by copyright statute that might otherwise infringe. We're using everything we use today for research purposes, for educational purposes, to educate the masses. Reach one, teach one, as they say. Degenerative disc disease. That's what we're going to look at first. Okay. Degenerative disc disease is a condition that occurs when the Cushing's disc between the vertebrae in the spine begin to wear down, often leading to neck and back pain. This condition typically affects individuals over the age of 40 as the discs lose hydration and elasticity over time, which can result in reduced flexibility and increased pain. Symptoms may include intense pain, numbness, or weakness in the arms or legs, depending on the affected area of the spine. Treatment options often include physical therapy, pain management, in some cases, surgery to relieve symptoms and improve functions. Now, I will say that there are different kinds of surgeries for, disc degeneration and degenerative disc disease. There's also mild, severe, moderate, so different people have it in different ways. Some people also have with degenerative disc disease, they also have a bulging disc. They also have discs that are out of whack, and some of them actually have perforated, torn, and sometimes the disc itself ruptures. Now, when it ruptures, you have a thing called bone on bone. So instead of there being that cushion between the vertebrae, there is nothing, and it is bone on bone pain, which is very severe. And a lot of things that we get for muscle pain does not help with degenerative disc disease, right? So I'm going to see if we can find us. And it does happen over time to most people naturally, when they've worked their life or they've done hard labor or things like that. For some people, it is caused by genetics. For some people, it is caused by, an injury of some kind that they had, whether it be work related, an accident, a car accident, so on and so forth, right? It varies per person, right? And degenerative disc disease can cause different problems for each person. Each person has you have cervical disc degeneration, you have lumbar, you have the thoracic. Some people have it throughout their entire back. So it just depends, in how it affects each individual person, right? It does. It is different for each individual person. And in spine surgery, you can have different kinds of spine surgeries. You can have fusion. They have some new ones out that I've always been curious about. So I'll show you the surgeries that they have. Surgery options. Let's go to surgery options. Let's go to all right quick so we can see. So here is the surgery options, right, for degenerative disc disease. So they have non-surgical treatments are typically suggested for no less than 6 to 12 weeks before surgery is considered, although in most cases, non-surgical treatments are used for much longer. It is estimated that only 10% to 20% of lumbar disc degeneration cases and up to 30% of cervical disc degeneration cases are not successfully treated using non-surgical methods and warrant surgery to relieve pain and improve mobility. Prior to deciding whether to have surgery for degenerative disc disease, patients should consider the risk and benefits. Consideration before spine surgery. Recovery process. The recovery period following spinal surgery can consist of a combination of physical therapy, pain medication, and wearing a back or neck brace. Lifestyle considerations. The everyday lifestyle changes needed for either non-surgical or surgical treatment may be considerable. In the case of surgery, a long recovery process may require significant time off from work. Additionally, regular physical therapy and pain management will be required for optimal results. Imaging evidence of disc degeneration. Spinal surgery for degenerative disc pain is typically only recommended if an imaging scan correlates to the specific cause of pain, and even then, outcomes are not always predictable. Spinal surgery is always elective, meaning it is a patient's choice whether or not to have the procedure. A spinal fusion is the most common procedure used for degenerative disc disease. In recent years, an artificial disc replacement has become more widely used as devices and surgical methods have improved. Spinal fusion degenerative disc disease. This is what it looks like. You see how they take these little brackets and they spine the fuse, they put a bone graft right there. Okay. During a spinal fusion surgery, two adjacent vertebrae are grafted together to alter the underlying mechanism causing pain. A fused joint elements instability at the spinal segment, reducing pain, causing micromotion, muscle tension, and or inflammation. Joint fusion can also allow for more thorough decompression of pinched nerves. A spinal fusion procedure typically consists of the following steps. Under general anesthesia, an incision is made to approach the spine. For a cervical fusion, the incision is usually made in the front of the neck. For a lumbar fusion, an incision is may be made in the back, front, or side of the body. Muscles surrounding the spine are cut away or pushed to the side to access the spine. The degenerating disc is removed from the disc space. A bone graft or instruments are implanted across the disc space to stabilize the spinal segment and encourage bone growth. The spinal muscles are replaced or reattached, and the incision site is closed with sutures. A fusion surgery sets up the mechanism for bone growth, and the fusion occurs in the months following the procedure. For this reason, the complete recovery process from a fusion surgery can last up to a year, although a majority of patients are back to their regular activities within 6 weeks. Following surgery, use of back or neck brace may be advised to keep the spine stabilized and to minimize painful movements that can undermine the healing process. Additionally, physical therapy is usually recommended to condition the muscles to better support the spine, and pain medications are prescribed to manage post-surgical pain. Artificial disc replacement. Now, this is the one I was curious about. I'm not sure if anybody's had it to know how this works. Degenerative disc pain can also be significantly reduced or eliminated by implanting a device that mimics the natural support and motion of the spinal disc in a procedure called artificial disc replacement. Unlike a spinal fusion, the procedure is intended to maintain motion at a spinal segment after surgery. The spine is approached through a small incision under general anesthesia. During a cervical ADR, the incision is usually made in the front of the neck. During the lumbar ADR, the incision is usually made in the back, directly over the spine. The muscles are moved to the side or cut away from the spine. The degenerative disc is removed entirely, as its degenerative portions of the spinal joints or adjacent vertebrae in the disc space. The artificial disc is inserted into the disc space using an X-ray imaging to guide the device. Some devices also include metal plates that are attached to either vertebrae facing the disc space. The muscles surrounding the spine are reattached and the wound is closed. Artificial discs are typically made of metal or plastic materials. The recovery process from an artificial disc replacement usually consists of a combination of pain medications, physical therapy, and possibly wearing a back or neck brace. Recovery from this procedure can take up to 6 months. I've always been curious about this one specifically because I was not even sharing the tab, y'all, while I was reading that to y'all. I've always been curious about that one specifically. I don't even have I'm reading y'all this stuff and I don't even have it pulled up on my screen. Y'all gonna get me, child. Y'all gonna get me. But I've always been curious about this surgery versus fusion. Now, I had a cousin who had, this is what the spinal fusion looks like. See the brackets that they put on the back and then they put the bone graft in there. This kind of surgery, what I've heard is you lose range of motion. And a lot of people have told me once you start getting fusion surgery, you end up having to have your whole back fused. My doctor that I had gotten when I started seeking a doctor for this right here basically told me that where my pain or where my problem is in my back that eventually I would end up having to have my whole spine fused. Because what happens is, as you get that part fused, it puts too much pressure on the one above and below it, and so it ends up migrating, and eventually it keeps going further and further up. And as young as I am, that's what would happen to me, right? And eventually my entire spine would have to be fused. Now, I have a cousin who actually ended up having to have that done, and they say the pain is worse after the surgery than before the surgery. So I'm like, I don't know if I want to deal with that. I don't know. I don't know. Now, one of the beautiful people that I know, Princess Shell, said that she had something implanted. It's called I'm gonna show y'all what it is. Let me open this up. And I've never heard of this myself or had this be a thing. But she had this done to her. It is called a let me look at the name of it again. It is basically where they stick this device in your back, and it's supposed to block the pain. Let me look at the name of it again. It is called a CSC, spinal cord stimulator. It's called a spinal cord stimulator. And they supposedly put it in your back, and it's supposed to help, like, stop the pain or something. I'm like, I don't know about that too much. I'm one of those people that's kind of iffy. I'm kind of iffy about that. How y'all doing in the bushes? How y'all doing? I saw y'all pop up. Y'all, y'all could drop down and say hi. We just talking about back pain this morning, and you know, health is wealth. We talking about different diseases that can cause pain and different things like that. We're going to be talking about fibromyalgia and different things. I've heard of people having, CNS, a bunch of different stuff that can cause that situation. It's something that a lot of us live with every single day of our lives, right? And have to deal with. And to educate others on what someone else goes through and what they feel every day of their life helps you understand people better, right? Helps you be a better person and to be able to understand and like every person's journey through life is different, even though a lot of us have to deal with some very similar things for different reasons, right? So my issue was caused by a wreck that I had when I was only 15 years old on a school bus, an innocent child going to school, right? Someone else's might have been caused because they were working, let's say as a roofer for most of their life, or they were a mechanic and some kind of accident happened at work. Someone else may have gotten the disease genetically or something like that, or may have gotten an autoimmune disorder that causes it for them. And each person is different. Each person's story is going to be different. Even though it's a very similar thing that we all deal with, each person has to deal with it differently. Just like what works for me may not work for you, or vice versa. So when I say about these surgeries, what scares me doesn't mean that you have to not have them, because it may work for you. I have my fears about them, right? But that doesn't mean that you yourself, it may work perfectly fine for you. Just like for some people, what I've heard about I've been doing my research on the SCS spinal cord stimulator. For some people, it works great. Other people's not so much. And what's good for one person may be different for another. Just like we all, when we take medications for the first time, right? The blood pressure medication I'm on may not be good for you, right? But it works for me. I may not have any side effects, but you could have some. It's the same thing with these surgeries. Some of these surgeries for some people, I hear work very well, and it makes their quality of life better. While others, I hear it does wrong to them, right? So you have to talk to your medical professional and figure out what is best for you. Always talk to your doctor about everything. Do not try, like I would say this: do not even get on certain medicinal, like vitamins and stuff without talking to your doctor and your pharmacist, because one medication that you're taking, that vitamin and or something like that could be counterintuitive. So make sure that no matter what you decide to do in your life, that you do, um, you know, converse with your medical professional and your doctors, your specialists. Talk to your pharmacist if you're taking any regular medications. Some people don't know that you cannot eat grapefruit while taking certain medications, and there are certain foods that you cannot eat while taking certain medications because it can counterreact with that medication and either make it more powerful or less powerful or not work at all. It can interfere with medication. So when you're taking any medication, make sure you know what you can and cannot take, just like with surgeries, know what all possibilities are. And always never be afraid to get a secondary opinion. If you don't agree with what one doctor says, or you're scared or something like that, or you don't, always contact a secondary doctor. Have a second opinion run, right? Second opinions are our ability to do so, right? That's why we have so many regular doctors. That's why we have so many specialists, um, surgeons, and such. Make sure you get secondary opinions if you don't agree with something or if it feels wrong to you. Do what's best for you and your life. But I have always, on this one, been curious about if anybody's ever had it. So if you've ever had artificial disc replacement, please let me know. I would love to talk to you and hear from you about how it worked for you, how long you've had the surgery, what was the recovery time. I've heard of spinal, even if you've had spinal fusion, I would like to hear about your story and what you've been through and what you go through and how it's working out for you. Because I think we learn as humans from listening to other humans and what they've been through, right? Just like, here's another disorder that actually causes chronic pain. Fibromyalgia is a chronic condition characterized by widespread pain, fatigue, and various other symptoms with no known cure but manageable through various treatments. Fibromyalgia is a chronic condition that causes widespread pain throughout the body. It can often accompany other symptoms such as fatigue, sleep disturbances, and cognitive difficulties, often referred to as fibro fog, which affects memory and concentration. The exact cause of fibromyalgia is unknown, but it is believed to involve a combination of genetic, environmental, and psychological factors that affect how the brain and nervous system process pain signals. Symptoms. The main symptoms of fibromyalgia include widespread pain, often described as a constant dull ache that lasts for at least 3 months. The pain is considered widespread if it often occurs on both sides of the body, above and below the waist. Fatigue. Many individuals report waking up tired even after a full night's sleep due to disrupted sleep patterns. Cognitive issues. Difficulty focusing, paying attention, and remembering things, commonly referred to as fibro fog. Other symptoms. These may include headaches, irritable bowel syndrome, anxiety, depression, and temporomandibular joint disorder, or TMJ. Causes and triggers. While the exact cause of fibromyalgia remains unclear, several factors may contribute to its development, including genetics. A family history of fibromyalgia may increase the likelihood of developing the condition. Physical or emotional trauma, events such as injuries, infections, or significant emotional stress can trigger symptoms. Other health conditions. Fibromyalgia often coexists with other conditions such as rheumatoid arthritis, lupus, and chronic fatigue syndrome. Diagnosing fibromyalgia can be challenging due to the overlapping of its symptoms with other conditions. There is no specific test for fibromyalgia. Instead, healthcare providers typically rely on a combination of patient history, symptoms assessments, and ruling out other conditions. Treatment and management. Medications. These may include pain relievers, antidepressants, and anti-seizure medications. Therapies. Physical therapy, cognitive behavioral therapy, and stress management techniques can be beneficial. Life changes. Regular exercise, a healthy diet, and good sleep hygiene can help alleviate symptoms. Fibromyalgia is a complex condition that affects millions of people, particularly women. Understanding its symptoms, potential causes, and management strategies can help those affected and lead a more comfortable and fulfilling life. If you suspect you have fibromyalgia, it is essential to consult a healthcare provider for a proper diagnosis and treatment plan. So we're just basically talking about, the different things that people go through, like the different, there's all different kinds of um, pain and sensory things that people go through when it comes to degenerative disc disease, when it comes to fibromyalgia, lupus, any autoimmune disorder. Um, pain disorders themselves are not easy to deal with, right? And a lot of people have to deal with that on a daily basis. And some people will put down a person who has a pain disorder, or a lot of doctors nowadays automatically think you're a pain seeker or different things like that. And it's really sad, because imagine having to deal with that every day of your life, right? Every day of your life, that never goes away. It's not an easy thing, but that's just, part of life and part of what it is to have different pain disorders, different things that go on in your life. Health is wealth, and a lot of people have a lot of different things that they deal with on a daily basis. Me, myself, and I have a lot of things that I deal with physically every day. Mental health wise, I deal with every day. And I keep going and I keep pushing. And I think that's what we should all strive to do, right? But I would like to play this about the spinal cord thing, or actually, I'm going to I'm going to show y'all, like, there's a lot of people on TikTok who talk about this situation. And some people say the trial for it works, and then when they get the actual thing implanted, for some reason it really doesn't work for them, and then some people say it does. Um, and I will say that none of these things that are going to make you completely pain free, like 100% pain free. Pain medications are not going to make you 100% pain free. In fact, you don't need to be 100% pain free, because pain actually does tell you if you're trying to injure yourself. You need to feel a little bit of it, because if you don't, then you'll actually hurt yourself, right? So there is disorders also where people don't feel pain at all, and they have to worry about cutting themselves. They have to worry about getting infections. They have to worry about accidentally breaking bones because they can't feel it. I don't know if y'all ever watched. It was one of the doctor shows, right? And the kid couldn't feel pain at all, so they literally, said, "Oh, look what I can do," and they hurt themselves. And then they thought that the parents were abusing this child. No, come to find out, the kid, just because they couldn't feel pain, had broken their arm and done these things because they thought it was funny, not realizing that they were actually causing life or death situations. It's called SIPA disease, when the person can't feel pain at all. It's a congenital disease. Um, and Congenital intensity to pain with anhidrosis. Congenital intensity and pain and anhidrosis is a rare disease that causes a person to not be able to feel pain or sweat. This article will cover the causes of CIPA, and you will learn about the signs and symptoms of CIPA and how it is diagnosed and treated, and tips for living with CIPA. Hereditary, because it runs in families. Sensory, because it affects the nerves controlling sensations in the body, which includes pain. Autonomic, because it affects the autonomic nervous system. which regulates sweating. Symptoms of SIPA. SIPA is a disease that a child is born with. A childhood with SIPA cannot sense pain or temperature. They do not feel pain and cannot sweat or do not sweat enough. Since the symptoms of SIPA show up in childhood, the disease is usually diagnosed early in life. Lack of pain. The main symptoms of SIPA is not being able to feel pain. In fact, a child with SIPA has no concept of what pain is. Usually, SIPA is discovered when a parent or caretaker notices that their child is unaffected by things that should hurt them. For example, you might think your baby is tough for not crying when they get routine vaccinations, but that could be a clue that they are not experiencing pain normally. You should tell your provider if your child has a pattern of not responding to typical pain events. There are also other signs of SIPA to watch for. Kids with SIPA often have a lot of injuries because they do not get the pain signals that would teach them to avoid things that are dangerous, e.g., the pain of burn helps them learn not to touch a hot stove, get infections, or have injuries that don't heal because they do not instinctively care for them or try to protect them from other things that would cause more pain. If a provider notices that your child is not responding to pain normally, they might want to do more tests to see if the child could have SIPA or another sensory problem. Anhidrosis or lack of sweating. In addition to not feeling pain, children with SIPA cannot sweat or have a decreased ability to sweat. This makes it harder for them to control their body temperature and can lead to heat-related illnesses such as heat exhaustion or heat stroke. Heat stroke is a medical emergency. If the following signs and symptoms of heat stroke develop, call 911 or go to the nearest emergency room. Body temperature above 103 degrees Fahrenheit, hot, red, dry skin, rapid, strong pulse, headaches, dizziness, nauseousness, confusion, and loss of consciousness. Other SIPA symptoms. People with SIPA may have other symptoms, many of which are actively related to not responding to injury or illness. So, healing from skin and bone injuries, chronic bone infections, Charcot joints, malformations caused by the lack of sensation, febrile fever-related seizures, dental cavities, difficulty with bowel and bladder control, behavioral problems, intellectual disabilities. What causes SIPA? SIPA is a disease that you are born with. It is an autosomal recessive, which means that the child has to inherit a gene from both parents to have the condition. Unless you or a close relative has SIPA, you may not realize that you have the gene until your child is diagnosed with SIPA. The abnormal gene responsible for SIPA, human TRKA or NTRK1, tells the body to make mature nerves. And abnormality in the gene means that your sensory nerve and some automatic nerves do not fully develop. The underdevelopment of sensory nerves can not send messages to your brain about pain and temperature. For example, your brain tells your automatic nervous system to make you sweat, but the message is not received. How is SIPA diagnosed? There is not an easy test to identify SIPA, but providers do have a few tools to help them make the diagnosis. For example, they can take a small tissue sample and look at it under a microscope. It's a biopsy to look for underdeveloped nerves and no sweat glands. The most definitive diagnostics test for SIPA is a genetic test to look for an abnormal TRKA or NTRKI gene. This can be done before birth or at any time during your life or your child's life. Can SIPA be treated? There is no cure for SIPA. There is also nothing that can replace missing pain sensations or make you sweat more. Treatment for SIPA is really about living as safely as possible with the condition. For caregivers of children with SIPA, this means teaching them how to manage their activities and care for themselves since they won't be getting pain or temperature signals to help them out. Lack of pain. Pain is the body's alarm system. Without it, you may not know you have injuries, even if they are serious. You may re-injure yourself regularly because there's no pain signal to help you avoid doing so. For example, without pain as a cue, you might not you're doing too much on a broken leg that's trying to heal. If you have SIPA, it's important to learn how to prevent injuries and to monitor any injuries you do get carefully so they don't become infected or more damaged. When children have SIPA, it is up to their caregiver to keep an eye on injuries. It's also important that kids with SIPA learn strategies for staying safe. Lack of sweat. Kids with SIPA also have to learn how to manage their activities when they can't sweat or won't be able to sweat enough to cool their bodies. Many of the same measures that prevent overheating can also help with um, heating. For example, avoid exertion in hot environments, stay in the shade as much as possible when outdoors, rest often in the heat, drink cool liquids, or eat popsicles. Wear lightweight, loose, light colored clothing made of breathable fibers like cotton. Use air conditioning indoors when possible. Use cooling products such as neck wraps, bandanas, and vests, or cold compresses. Take cool baths, especially before and after exercise. Go to the swimming pool or use the kiddie pool at home. If a child with SIPA has a high fever, give them over the counter fever reducers such as Advil, ibuprofen, Tylenol, or Aleve as approved by their pediatrician. Use cold compresses instead of ice baths. While it may seem like ice or cold baths would help a fever, they can cause chills that will increase the body temperature rather than bring it down. Coping with SIPA. Good medical care and lifestyle changes are keys way to live safely with SIPA. These strategies should be implemented as soon as the diagnosis is made and adjusted as needed throughout a child's life. SIPA is a rare disorder, making it challenging for families to cope. Joining a support group, especially one for uncommon disorders that most people don't know about or understand, can be a relief and make you feel less alone. These resources can also help you find practical ways to make living with SIPA easier. Since SIPA is an inherited disorder, adults with the condition will want to discuss it with their partners and providers if they're thinking about planning for a family. Summary: SIPA is a rare genetic disorder that makes you unable to feel pain or sweat. It is caused by a defective gene that disrupts the normal development of sensory or autonomic nerves. The lack of pain means you might not know when you get hurt. This can lead to repeated injuries or wound infections. Lack of sweating can make you overheat, and you could get high fevers or other complications like heat stroke. There is no cure for SIPA, and the treatment is mostly about staying safe. It is important to avoid injuries and monitor any wounds for infections. Support groups can be helpful for social support and tips for living with SIPA. So that's what I was talking about. So either you can have either too much pain in your body or not enough pain in your body, right? So that's the thing that a lot of people live with every single day of their life, right? Every single day of their life, they can live with that. So you have people who deal with pain disorders where they have too much pain or not enough pain. And people have to deal with different disorders in their lives, whether it be physical or whatever. Hey, the hood table, love. How you doing, beautiful? Yeah, I was just sitting there reading the I was sitting there talking about, like, a lot of people deal with like back disorders, pain disorders and things like that. Well, there's also the polar opposite. I don't know if you ever watched that doctor show about that little kid who had SIPA. Basically no pain receptors at all. They can't feel any pain. So like they can break a bone and not even know it, which is actually very dangerous. You actually do need pain in your life, whether it be just for a little bit. You got to be able to feel something. If not, it can be very dangerous. So, like I was talking about, back disorders and different things, surgeries are not going to take away pain. Pain medications are not going to take away pain fully. You don't need to take away pain fully. You need a little bit so you know when you injure yourself. Without pain, we wouldn't know what's hot, like touching a hot stove or accidentally twisting an ankle or so on and so forth. And you also wouldn't know how severe your injury is and would actually hurt yourself without pain. So you do need a little bit of pain, even if you don't like it. But no, that's just basically what I was talking about. How you doing this morning, girl? You doing all right? I was just sitting there talking. We was talking about health is wealth, girl. Health is wealth. Oh, I got to stretch this morning. Oh, still waking up. But no, yeah. Ooh, there we go. I had to stretch it out. I had to stretch it out. Oh, yeah, man. I got to tell you what happened to me last week, Hood Table, though. Girl, I stretched and I messed myself all the way up. I stretched and messed up my neck so bad. Child, I didn't know getting older, you got to be careful stretching. I didn't know that. I didn't know you could possibly injure yourself from a stretch. I can't wait for you and Big Rig to do more content. I was telling hubby that I just think y'all two are so cute together. I know, I know, I know. I still ship it though. Even if y'all, whatnot, I still ship it. I always will. How's my baby Ace doing? I can't believe Ace is getting so grown on us. It ain't right. It ain't right. He needs to go back to being a little bitty baby again. He need to go back to being a little bitty baby again, that little precious angel. Oh, I'm tired this morning too. I swear to God, I need a nap. I'm always needing a nap though. When don't I need a nap? Naps are awesome. I can't believe he's 4 already either. It seemed like just the other day we was getting ready for his first birthday, and then it seemed like just the other day he was a little bitty baby, barely talking. Ooh, y'all gonna be live on your channel this Sunday evening discussing trending news. I'm gonna have to be over there Sunday evening because I love listening to y'all too. I think y'all do well together, bounce off each other good. I really do. I think y'all do very, very, very well together, bouncing off each other, and you know, when y'all do y'all's trending topics or y'all's content together, I think y'all do very, very well. And y'all have very like y'all are just enough opposite and just enough alike, if that makes sense. But I still can't believe that Ace is almost he's already 4. It ain't right. He'll be starting kindergarten next year, girl. He'll start kindergarten next year. Can you believe that? I mean, he's already old enough for school. That ain't right. That ain't right. Uh-uh. Our children growing up way too fast. It's like you blink. I'll say this, Hood Table, even looking at my own son, it's like I blinked and he went up to the age that he is now. Now I will say this: I don't know if that's you really square or if that's someone using your name. But if you got to come in here and say something, say it to my face and stop. Don't be a little bitch about it. But if it's a troll, don't do that shit. Either come under your real name and be your damn self. Okay, just saying. I like that. I like having y'all's different perspectives come together. I think it does very well together. Hold on just a minute, y'all. Uh, yeah. Yeah, I'm not sure if that's a troll, the hood table, or if that's actually that person because sometimes people do that. They'll come under a person's name. I'm not sure, uh, or not. But if they're gonna be trolling, at least use your name and say who you are. And if it is that person, why the fuck are you even over here in the first fucking place? Just saying. Yeah, I know, but sometimes I don't understand why people want to do that shit. I don't get it. But I'll see them somewhere else and I'll ask if it was really them or not. Because technically, here's the point. I ain't bothered them. They have no reason to bother me. Secondly, it could be somebody else pretending to be them. I'm not sure. I checked the account, but the account is brand new and it's not the person's like real account, but it could be their troll account. You know, you never know. A person can also lie and say it ain't them when it is them. So you don't never know about that shit. You know, I don't know why that song's going through my head. But anybody who has to deal with a pain condition every day of their life, or has to deal with, back condition, neck condition, fibromyalgia, lupus, amputations, so on and so forth, they have to deal with different things in their life, and understanding what they have to deal with helps us to be better people. It's like when people go with mental health conditions, right? When people have different mental health conditions, understanding what they go through every day can help us understand them as a person, right? Can help us better to understand them. Do, 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 do. This is how we do it. I don't know why that song just went through my head either. It just did. Um, So, different situations go for different things. Also, with what the person said, that's called content. It's called real content. And not thinking anyone is ignorant or stupid, but that's how you create content. Like, do you not understand what content is? Okay. But I'm going to also today on Wellness Wednesday. I'm going to do a little bit of a mix today because tomorrow I may not do my regular time on my live tomorrow because of my son's dental appointment that he has. So, I'm going to look up some of the new um, things that are going on in the world today. I will say that they are right now having this situation in California with the with the hey Miss Tracy, good morning. Um, they're having that situation with the riots over there, and then a lot of people are keeping up. If you're wanting to keep up with the Diddy trial, the Hood Table herself is doing updates on the Diddy trial, so you might want to go up there and get your recaps on. Um, they're doing that over there. Um, a lot of people are covering the Karen Reed trial right now. How you doing, Miss Tracy? I was talking about the pain conditions earlier and degenerative disc disease and what people are having to deal with and different things like that and all that good, lovely stuff. And about, you know, not having pain is also a bad thing. You know, um, dealing with a pain condition every day, it sucks, but you would rather have some pain than no pain at all. Everybody's like, I want to be completely pain free. No, technically you don't, because then you wouldn't know if you injure yourself or hurt yourself, right? Pain is a receptor that tells us when something is hot to the touch or going to burn us, or tells us that we've injured our ankle or hurt our kneecap. And if we don't feel a little bit of it, then we won't know that we've actually hurt ourselves. I'm going to go ahead and drop the link for those who want to come up and speak about their pain condition and what they've been through in their situation, and whether they've had surgeries or whether they've had, different outlooks. Me, myself, and I have not had the surgeries. I've chose not to do the surgeries um, for my own personal choices, because I've heard that the surgeries actually can hurt you more than help you. And that's my personal, what I choose to do. Not every person is going to choose that. Some people are going to have the surgeries. Some people are going to do different things. Now, Miss Tracy was talking about, and we talked about it the other day. I did a, read about it and everything to everyone about radio frequency abulation and how that helped her. And every person is different too, like how we deal with things, how we deal with situations. Like for some people that may work, and for others it may not. You never know. But some people swear by it. Like there are certain people that say that the injections, the steroid injections in the back work. Some people say that the water blocks work. Different things that they do to try to help people who have these kinds of conditions. Some people say it works great, and others will tell you that not so much. So I do believe each person is different. Now, Miss Princess, if y'all don't know who she is, Miss Princess Shell, she had a thing implanted that was basically it's supposed to block the pain receptors or change it to where um, the um, the nerve that is conducive for pain, it's supposed to shock it to where you don't feel the pain as much. And that's a cervical spine. Um, what's it called? Cervical spine, something or another. Anyway, we were talking about it earlier. But there's all different kind of things going on in the world today that we could speak on and we can talk about. Do, 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 do. This is how we do it. All right. Let's go back to homepage. All right. Took care of that. I was taking care of some things for the old people. Y'all know I do that too. I take care of my old people. But if anybody wants to come up, you can. You don't have to. You're not pushed to. It's up to you if you would love to do that. Doing the different things with wellness and things, health is wealth. Different things that you need to do to take care of yourself. Always take care of your health because your health is wealth. Without it, you know what I'm saying? We really gonna fall apart in this lifetime. Like health is wealth. It's all we have. Is I'm gonna say this: the most precious commodity of anything that we have in this lifetime is time. Time. Time is very short on this earth. So take care of your, as in the Bible it states, right? To take care of your temple meaning your body. And if you don't take care of it, you're not going to have a long lifespan, right? So taking care of your body, taking care of your health, health is wealth. We only get one lifetime, or as far as we know, right? And so try to make it as happy and healthy as you can. It's not going to be perfect. It'll never be perfect, right? But you can try to make it as best as you can what you wanted to make it as. I'm going to show. Let's see. I'm trying to figure out. Okay. I'm going to show y'all some stuff on how to manage chronic pain. We have massages. You could have massages with soft tissue manipulation. I will say be very careful about massage therapy and chiropractic if you have a bad back or bad neck. It could lead to other dangers that you don't know of because you have to be very careful with the way that people. You have to make sure they know that. Also, if you go get a massage or if you go to a chiropractor, please let them know about your conditions. Um, be very careful with that. Physical therapy can help, acupuncture, cognitive behavioral therapy, yoga, tai chi, non steroid anti-inflammatories, opioids, cannabis, progressive muscle relaxation, hot and cold therapy, deep breathing techniques, and drug therapies can help manage chronic pain. Right? Chronic pain is something that a lot of people deal with on a daily basis. Not just for back conditions, different muscle conditions, different bone conditions, autoimmune disorders. There's so much, and you have to learn how to cope with it and how to deal with it. Because not only can physical pain affect your physical body, cause high blood pressure, things like that. Also, it can also affect your mental health, right? And it can make you depressed. It can have adverse effects for your mental health or whatnot, right? So make sure that not only do you take care of your chronic pain because you don't obviously want to live in chronic pain every single day of your life. It is also good to take care of it and stay on top of it because it also affects your mental health. Um, and it can affect it in different ways, right? Let's make sure. Okay. So I'm going to right quick scroll through here and find us um, some information to digest today so that we can reach one, teach one, and learn something new, possibly, or at least, understand what others go through, right? even if it's not something new to learn, sometimes this is how we learn in general, right? This is how we learn in general. And knowledge is power. Being able to understand other people and what they go through on a daily basis is also power. So let's listen to this right quick.
Hi, everybody. My name is Paul Green, and I'm a member of the Public Education Committee for ADAA, the Anxiety and Depression Association of America. Welcome to our webinar, Understanding and Managing Chronic Pain and Its Relationship with Mental Health, with presenter Dr. Risa Weisberg. These webinars are presented by ADAA, the leading nonprofit organization in the field of anxiety and depression. ADAA's mission is to improve diagnosis and promote the prevention, treatment, and cure of anxiety, depression, and stress-related disorders through education, like this webinar, practice, and research. We encourage you to take advantage of the many helpful resources on our website, adaa.org. I'm delighted to introduce our presenter, Dr. Risa Weisberg. Dr. Weisberg has devoted her career to developing and scientifically testing scalable interventions for common behavioral health problems. Her mission is to expand the reach of high-quality, science-based behavioral health treatment. She has over 2 decades of research, clinical, and leadership experience, which she now brings to lead the clinical direction and research strategy of behavior. Risa has a doctoral degree in clinical psychology from the University at Albany. She completed a doctoral internship and postdoctoral fellowship at Brown University. She is a professor of psychiatry at the Boston University School of Medicine and an adjunct professor of family medicine at the Alpert Medical School of Brown University. She is an expert in cognitive behavioral therapy and acceptance and commitment therapies. As a primary care psychologist, Risa has broad experience in treatment development and implementation for common behavioral health problems, including anxiety, depression, chronic pain, substance use, and adaptation to living with other chronic medical difficulties. Her research has been funded by the National Institutes of Health, the Patient-Centered Outcomes Research Institute, the Veterans Administration, and numerous foundations. Risa is a member of the Scientific Council of the Anxiety and Depression Association of America and a fellow and former board member of the Association for Behavioral and Cognitive Therapies.
Thank you so much for the introduction, Paul. I'm delighted to be here today to talk to you about understanding and managing chronic pain and about its relationship with mental health. Before we get started, I just want to give some disclosure information. As Dr. Green mentioned, I am currently the Chief Clinical Officer of Behavior Inc., and we are a for-profit company that develops CBT and ACT treatments in virtual reality. And we do have some chronic pain interventions in the market and are developing some others. So that is a disclosure that you should be aware of. So I'll get started with a definition of pain and chronic pain. So pain itself is defined as an unpleasant sensory and emotional experience associated with actual or potential tissue damage. There's a lot to unpack there, which is why I'm starting with a definition. So by definition, pain's unpleasant. And by definition, it's not just something that you feel in your body, but it's also an emotional experience. And it can be associated with actual damage, but sometimes it's really associated with potential damage. And that leads right directly into the definition of chronic pain, which is that you have that pain and it lasts at least 3 months. Some people define it as 6 months, but that the source or the cause of the pain is often ill-defined. So sometimes with chronic pain, it's not directly associated with actual tissue damage occurring. And very importantly, that in chronic pain, the pain no longer serves an important warning function. And we'll get back to that and talk more about the warning function and alarm function of pain in just a bit. Chronic pain is extremely prevalent. We know that 1 in 5 Americans will experience chronic pain at some point in their life. And if you're a veteran, the chances are much higher. About 50% of veterans who receive their care at the VA experience chronic pain. So this is a highly prevalent problem. It's also very closely associated with other types of mental health problems, including depression and anxiety. So this is a very large national epidemiological study, and they found that individuals who had chronic pain, 17.5% of them also had a mood disorder, and over a quarter of them also had an anxiety disorder. So these things often travel together. Chronic pain also, not surprisingly, probably to many of you, also often comes with insomnia. And people who have chronic pain are 18 times more likely than the general population to have insomnia. I think for a lot of us, the thought is that the pain is what keeps you awake at night, and that is certainly true for a lot of people. But interestingly, research has found that there's really a bidirectional relationship between chronic pain and sleep difficulty, and that poor sleep may actually, in some cases, precede pain, or when you have chronic pain, lead to the worsening of pain. And so those things really feed back into each other in a bit of a vicious cycle. The other problem that, not surprisingly, probably most of you can often travel along with chronic pain is addiction to prescription opioids. So we know that back in the earlier part of this century, many providers were prescribing opioids specifically for their chronic pain patients. And when you think back to that prevalence slide, that it's about 1 in 5 people who have chronic pain, there's a lot of opioid prescriptions going out there. Numbers started to come down a little bit as we learned more about the negative consequences of prescription opioids, but still maintained pretty high. And so in 2017, this is our latest data, 17.5% of the US population received a prescription for an opioid. And we also know that in 2020, over 16,000 Americans died from an overdose that involved prescription opioids. So lots of opioids being received and really negative consequences for folks. These rates are much higher, 5 times higher in 2020 than they were back in 1999. And many of these individuals who died from prescription opioid overdose were first exposed to their opioid for treatment of their chronic pain. So there's a lot of things that are all pretty negative feelings and consequences that travel along with chronic pain. People with chronic pain are more likely to experience anxiety and depression, sleep problems, and opioid use problems. And unfortunately, people who have anxiety or depression are significantly more likely to develop problematic use of their opioids when they're prescribed those opioids for chronic pain. So this can often really lead to a bundling of lots of difficulties in living all at once for people with chronic pain. Not surprisingly then, your folks with chronic pain have lots of interactions with the medical system, and unfortunately, they're not always pleasant. Hopefully this data looks better now. I couldn't find anything more recent. And I'm hoping with more and more education about the suffering that individuals with chronic pain are going through, these numbers look better. But this was a large survey of primary care providers back in 2011 in terms of their attitudes and feelings in treating chronic pain. And unfortunately, they were predominantly negative. At that point, only 15% of family physicians agreed with the statement, "I enjoy working with patients who have chronic pain." And a lot of the words that they used to describe their experience working with these patients or what patients with chronic pain felt like to them were time-consuming, demanding, non-adherent, drug-seeking, and even impossible to please. Not surprisingly, chronic pain patients are then routinely dissatisfied with the treatment that they receive in primary care. This is a contentious relationship in a lot of ways for a lot of people. You're suffering, you're experiencing a lot of difficulty. Sometimes you're experiencing additional difficulty because your provider prescribed you an opioid medication to treat that pain and now is maybe telling you that you need to come off it. And that feels confusing because you feel like it's the one thing that's helping you. Or perhaps you feel you need to come off it and you know that you're now suffering from further opioid addiction and there's anger and frustration because it was your doctor who was trying to help you who got you started in the first place. Some of primary care providers' difficulty relating to treating chronic pain patients comes from the fact that doctors go into doctoring because they want to help patients. And it's frustrating to have patients for whom they feel like they can't really help. So this often comes from a very good place. It's coming from this feeling of they want to be able to make a difference in their patients' lives. They want to make an impact. They want to end your suffering. And unfortunately, chronic pain is hard to treat. And sometimes people just don't get better. And that they've gotten themselves involved, unfortunately, in many cases, in the sort of vicious cycle related to opioid use, in that they know that they maybe were prescribing this to patients and now really feel a very strong ethical responsibility to get their patients off of opioids, and yet it's difficult for patients to come off. So from their perspective too, it doesn't necessarily come from a place of not wanting to help. It comes from a place of really, really wanting to help, but this being a difficult thing to treat and a difficult relationship. So what are the treatment options for individuals with chronic pain? Well, we already talked about why opioids are not really a great solution. Surgery sometimes then is thought of as a good backup solution. Unfortunately, it's not a cure-all for everyone. Only about 60% of individuals with chronic low back pain experience even minimally clinically significant decreases in pain after they have spinal surgery. And there's actually been some other data from large systematic reviews where there's a number of studies where they'll actually compare sham surgery. So that's actually where a patient believes that they're going in to have a surgical procedure done, a specific surgical procedure. They're put under anesthesia, an incision is made, but the surgery does not take place. This is obviously all with consent and people know they're part of the study. And comparing that to having actual surgery done, orthopedic surgery done. And a number of systematic reviews have shown that for a number of different kinds of surgeries, not only spinal surgeries, but from some knee surgeries, other joint surgeries, there is often no difference between sham surgery and actual surgery in terms of the effects on pain afterwards. So surgery does work for a number of people, but it's important to have a full conversation with your providers before taking this on. In part because of the difficulties related to opioid use and also to some of this data about surgery and how invasive it is, the most recommended treatment guidelines for frontline treatments for chronic pain are psychotherapy, which is predominantly cognitive behavioral therapy, including other branches of cognitive behavioral therapy like acceptance and commitment therapy, or what's often called ACT, and mindfulness treatments, and NSAIDs, things like ibuprofen. At second line are then antidepressant medications, which can often have a strong anti-pain response, and also acetaminophen. Fortunately, there's also a lot of other non-pharmacological, non-invasive treatments that do work for individuals with chronic pain. So this was a large systematic review of clinical trials for non-pharmacological, non-invasive, non-surgical treatments, and looked at both sort of short-term effects and longer-term effects on both pain and functioning. And you'll see that a number of interventions, that some of which are widely available, massage, yoga, just getting regular exercise, acupuncture treatments, spinal manipulation, and multidisciplinary rehabilitation, which is typically done at a pain center where you're getting physical therapy in combination often with some other types of treatment, whether that's acupuncture or massage or some components of psychotherapy. That these treatments all really had some effect on both pain and functioning, and many of them both in the short term and the long term. But if you look at that top line, the effects for cognitive behavioral therapy, mindfulness treatments, were really the strongest and the most sustained at both short-term and long-term.
So related to that, Dr. Weisberg, I wonder if I could jump in with a couple questions that I think
Yes,
some of our viewers might have. Well, first of all, about CBT, I wonder if you can explain to people a little bit more about what that is and how it's understood to help with chronic pain.
Absolutely. Actually, I have a few more slides going through some of that. So that was a great question. So one of the key components of CBT is providing education about pain itself. And this actually pain neuroscience education has also been tested really just as a standalone treatment too, or tested in combination with physical therapy and with getting some exercise. is a really essential part of cognitive behavioral therapy for chronic pain. Is one of like the cognitive pieces of cognitive behavioral therapy is better understanding what pain is and isn't. And there's evidence learning better what chronic pain is. And a lot of this will define pain in this manner. So in both acute pain and chronic pain, your pain is real. I tell all of my pain patients, don't listen to anyone who says pain's in your head unless they're treating you for headache. Any other pain is in the part of your body where you're feeling that pain, and it's also in your brain and in your nervous system. But if you're feeling pain in your knee, that pain's in your knee. If you're feeling pain in your back, that pain's in your back. Your pain is real. The differences are that with acute pain, the pain lasts for a relatively short period of time and tends to reduce over time in kind of a gradual and systematic way for the most part. And the pain is there as a really normal response to some type of injury or maybe some underlying medical condition, a fever or something like that, and your experiences. And so a lot of CBT will focus on helping people understand these differences so that they have a better sense of what pain means and doesn't mean. Cognitive behavioral therapy really is about cognitions, or what you think, behaviors, what you do or don't do, and sensations, physical sensations in your body, what you feel. And so with pain, it's really about this link between the physical sensations you feel of pain, how you respond to them behaviorally, what you do or don't do in response to them, and the thoughts you have about that pain. And CBT will focus really on trying to change mostly your thoughts about the pain and what you do and don't do in response to the pain, in hopes of then breaking that feedback loop to change what you feel in your body. So more of the focus is on what you think and do in response to the pain. One of the big pieces of this has to do with the idea of pain catastrophizing or fear of pain. And so again, pain is there to make you afraid, right? It's there to say, stop doing what you're doing something harmful. So there's nothing about
Hey, Miss Bambi. Yeah, I had a person come in under the name of Square, but I don't think it is Square. Just to tell you, if you scroll up, I'm not sure if you can see it. But I didn't know. Yeah, it was a troll. Okay. I figured so because I didn't think he'd come in here and just off the wall say this right here. This was the troll, pretty much. I just didn't think, I was like, nah, he would have come in with some other shit. You know what I'm saying? I figured so. We were just talking about pain, different things that people go through, and cognitive behavioral therapy and pain. Uh, you know, they have different versions. Yeah, I know. Yeah, it didn't sound right either. It didn't sound right either. If he was going to troll, he would have said something else. Oh, you're doing some more mob stuff? I gotta go up there and check out your cool things. Hey, Mr. Buster, how you doing? Good morning, good morning. We was just talking about health is wealth this morning, you know what I mean? And taking care of yourself and how chronic pain affects different people. Because some people with chronic pain, it does affect their mental health. Oh, I can't wait to be added to season 2. And girl, if you have to make me out to be a hoe or I'm an evil person and I stab somebody in the back, I'm cool with it. I'm not gonna get butt hurt like some folks do. You know what I'm saying? Because I know it's just a story. It's a story, okay? You know, if you can't, if you can't understand a story is just that, a story, you might have a problem. You know what I mean? So, ooh, that'd be awesome. I could totally have an affair, all kind of things, girl. Cause some people, yeah, it's a role play. It's not real. I don't understand why people get so butthurt over a story. Like, like some of your other cartoons and stuff. I noticed that people get butthurt over it. Yeah. Oh, you're trying the Rise mushroom coffee for the first time? Tell me how that works. Because I've heard somebody told me, Mr. Buster, that with my ADHD, that if I microdose certain mushrooms, that it would help a lot. There was this one dude that's like what he does, and he has ADHD, and he microdosed, and like you don't get the like where people think you get the what do you call that what's the word I'm looking for uh the hallucinogenic properties of the mushroom. You just get the benefits of the mushroom. And I've been hearing that that actually works. So I would be very I'd love to know about that. Hey, Mr. MRH, how you doing this morning? I've heard about the Rise mushroom coffee, and some people say that it actually has really great health benefits for you in general. It's supposed to help you focus better, give you better immune support and energy. And for someone who has ADHD, I've heard that it's supposed to work. Yeah, I've heard that they're doing research on certain mental illnesses with mushrooms and the effects that it has for people. Hey, baby shark, do 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 do, baby shark, do 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 do, baby shark, mommy shark. Okay, I'm sorry. I just I got to do that every time you walk in. Hey, baby shark. But I have heard that hey, Miss Coffee, my beautiful, I've missed you, boo. I miss you so much. You just don't know. You my homie. But I have heard that different mushrooms that they are doing different studies to say that it's supposed to help with certain mental disorders. It's supposed to help with bipolar, ADHD. You know what I'm saying? I understand that, Miss Coffee. You know, I've always said one thing. What have I always said? Real life always comes first. Sometimes you get busy in life, and it is what it is. But I have heard that they are supposed to be looking at the medicinal effects of a lot of different kind of mushrooms for different things. You know what I'm saying? Different mushrooms, like the ones that we think of when people say, "Oh, I'm popping mushrooms to make you feel," to alter your mood. They're also talking about microdosing those so you don't get the effects of the you don't actually trip balls or nothing, as they would say. You get the effects of the medicinal properties, the medical properties, you know what I'm saying? The good part. That's just like, back in the day, they used to use cocaine as a analgesic to numb you, pretty much. Um, and there are certain other and then people started cutting it with different things, and they made it an addictive property. They made it bad for you, pretty much. But it technically, if you go way back, if you still today go up there and the coca plant itself, like I don't know if y'all know this, but there are certain I think it's a kind of monkey, but I'm not. Is it a orangutan or is it a gorilla or something? They literally chew up the maybe a spider monkey, maybe something like that. I forget exactly which kind it is. They actually chew on the leaves when they have pain, and it actually helps them. Like the actual leaves, like before people turned it into a drug, it is actually a plant that grows wild, and that they chew on that to help them with pain and stuff. And that it actually works for the monkeys and things, and they don't trip balls, they don't get high, all those other things. The medicinal properties of certain plants, plant life. Oh, no, they didn't. No, they didn't. Those are poisonous. Don't do that stuff. And you ain't never supposed to smoke them. You're supposed to make them into tea. And it's a specific kind. Those are the bad shrooms growing in the yard. You literally have to go into a cow field where cow patties are. And they don't grow anymore wild in the cow fields because they changed the food that the cows were eating. The reason that those specific shrooms grew wild back in the day was because there was a specific fertilizer, specific thing they put in the food of cows that created it. So when the cows pooped on the grass, it made the those mushrooms. And so people would wait till it rains, so all the poo's washed away, obviously, and the mushrooms would pop up and people would go get them. Those specific mushrooms that we heard about back in the day were created naturally from a food that they were feeding the cows. And there was something in the food which they've since taken out. So they do not grow wild anymore. That's why people are growing them themselves. I forget exactly what it was that was in the food, but there was something that was creating that hallucinogenic effect. But that's how those mushrooms were available back in the day, and why and people figured it out. But yeah, no, don't let the kids do dumb shit. And first off, you never smoke shrooms. You're supposed to make them into a tea. We're talking just about everything, church lady. I'm glad he told you though, because what if he did something stupid and actually did that and poisoned himself? Because that could have been really messed up. You know what I'm saying? Because that stuff can really, there are some mushrooms that are extremely poisonous that can really hurt you. No, actually, hey, Miss Catherine, good morning. No, there are some mushrooms that they're coming out with for health benefit wise. And they're talking about microdosing. You know, the ones that they had back in the day that were hallucinogenic, microdosing, you won't get the hallucinogenic property. You'll only get the good medicinal property. And they're saying that for bipolar, schizophrenia, for certain mental conditions, anxiety, ADHD, that if you microdose those, you won't get the hallucinogenic property, but you will get the, it's supposed to help you with that. Oh, no, they didn't, Mr. Buster. Oh, my God. You got to know. Here's the thing. I'm going to tell this to anybody. Please don't go out and just collect random mushrooms from out of your yard, because you can literally poison yourself. Please make sure you have a mushroom identifier and a book that identifies actual mushrooms that are good for you, because if not, you can actually hurt yourself. There is a mushroom that you can eat that grow, quite a few that you can eat that grow wild, and there are some poisonous ones that look just like those and can absolutely unalive yourself or poison you. Please don't accidentally do that. Please don't accidentally do that. There's one that grows wild that a lot of people down here know about. They call it chicken of the forest or something like that, and it grows on the side of trees. Well, there's one that looks just like it that's not it, that's extremely poisonous. So please identify your mushrooms before you eat a wild mushroom. Please make sure you do that. There's differences between them that, you know, if you look up, you can learn a lot. We're going to do some research here. I'm going to show y'all something. I'm going to present screen right quick, and we're going to learn about mushrooms right quick. How to tell the difference between poisonous and edible mushrooms. Okay, the simple answer to that is you can't tell the difference without identifying the individual mushroom you have found. Some poisonous mushrooms can kill, so you must be able to accurately name the fungus and be 100% sure what it is before consumption. There are some apparent rules for picking safe mushrooms, but these are just fanciful, if not downright dangerous. It's okay if you can peel the cap. It is easy to peel a death cap. Mushrooms growing on the woods are safe. Not all of them are. Some are deadly, like the funeral bell. If you see other animals eating them, they're okay. This rule is not true. Many animals can eat poisonous fungi with no ill effects. So these are like some things that people say that are not true. It's it's okay if you can peel the cap. No, it's very easy to peel a death cap, so that's not true. Mushrooms growing on wood are safe. That's not true. If you see other animals eating, that's okay. No, it's not true. Some animals can eat poisonous and it will not hurt them like it would us. Some good rules to apply for avoiding poisonous mushrooms if you are a novice. Avoid mushrooms with white gills, a skirt or ring on the stem, and a bulbous or sac-like base called a volva. You may be missing out on some good edible fungi, but it means you will be avoiding the deadly members of the Anamenthae family. Avoid mushrooms with red on the cap or stem. Again, you will be missing out on some good mushrooms, but more importantly, you won't be picking poisonous ones. Finally, don't consume any mushroom unless you are 100% sure of what they are. I know I have already mentioned this, but this is by far the most important rule. To me, it's the number one rule you need to go by. If you don't know, right, look it up. Look up the mushroom. This is Argyroix. The edible members of the Argyroix family all have pink to brown gills, a white cap, and usually a stout stem with a skirt. There are, however, toxic members of this family that look very similar. Once you have established that you have an Argyroix bruise, the cap, if it stains bright chrome yellow, it is probably poisonous. If it stains pale yellow, pink, or red, it is probably edible. But there is further tests to establish toxicity. You must smell the mushroom. Edible organics smell pleasantly of mushroom, some with hints of aniseed or almond. The toxic mushroom smell of Indian ink or iodine, or just chemically and unpleasant. Boletes. For example, the Boletus cilius and Lecinium families are easy to identify as they have gills but sponge-like pores and generally stout stems. There are two checks to make once you have identified a mushroom as a bolete to determine if it's edible. First, if there's any red anywhere on the mushroom, including the cap, stem, or pores, if there is, treat the mushroom as poisonous. Secondly, cut the mushroom in half vertically. If the flesh immediately or rapidly stains blue, again, treat it as poisonous. If the bolete in question passes the above test, it isn't a toxic mushroom. Sticking to the above rules means you will be missing out on some good edible mushrooms, but more importantly, avoiding the poisonous boletes. Milk caps. Milk caps are often from the Lecturius family, and they mostly exude a milky substance from the gills when touched or damaged. This milk can be very acidic and or hot, so should not be tasted unless you know your milk caps or can eat hot chilies raw. Most of the milk caps are toxic, so unless you learn to recognize individual membranes of this family, stay away from any fungi that lactates from its gills. Unfortunately, older milk caps tend to not lactate, so younger mushrooms usually need to be found to aid identification. Rullosuus. The Brittigillus or Rullosuus have very brittle gills and stems. There are many different members of this family, some poisonous, some delicious, some that just don't taste very nice. It is difficult to identify individual Russellas without studying them in depth. A good test for edible, however, is to taste test. If a tiny amount is placed on the tongue and chewed, a burn-like chill means the mushroom is poisonous. A pleasant mushroomy taste means it is edible, and an unpleasant taste means you wouldn't want to eat the mushroom anyway. This test should only be attempted when you are certain you have a mushroom from the Russellas family. Anamanthus. Anamanthus family all have white gills and spores, and more important, most grow from a sac-like or bulbous structure called a vulva, which can be hidden by a leaf litter or under the soil surface, or so it is vital to check the base of any mushroom you are trying to identify. There are a few edible amethysts, but the most poisonous mushroom in the UK are in this family, the destroying angel and the death cap. So this family should definitely be avoided by novice foragers. And you know, like if you sit there and you look, if you have mushrooms growing in your yard and you're wanting to try to do something like that, please do your research and don't just be eating shit. Okay. Okay, I got you. I got you, Mr. Buster.
What the hell are you yelling about?
Sorry about that. My son came in. We're gonna watch this story that Mr. Buster brought up, and we're gonna share. Let me go to share. And I'm going to mute up and we're going to watch this video from ABC News about people, you know, passing away because they want to play with mushrooms and they ought not to.
4 others in the hospital after eating soup made with mushrooms picked in the wild. It happened at an assisted living facility in Northern California. A caregiver apparently made the soup for the elderly patients, not knowing the mushrooms were poisonous. The caregiver is among those hospitalized. California health officials say there have been more than 1,700 cases of people eating wild mushrooms in 2009 and 2010. Officials repeatedly warned people not to eat mushrooms picked in the wild. 2 people are dead, 4 others in the hospital after eating soup made with mushrooms.
Pretty much, don't eat mushrooms you don't know how to identify. Okay? And it's sad that, you know, very sad in my opinion, that people are going to go eat something they have no idea about. Right? If you can't identify or have a forager book that shows you the different mushrooms, please don't just eat random mushrooms out of a yard or, you know, that are just all over the place because you don't know what you're picking or what you're eating, and it can be very deadly, poisonous, extremely. That's like when I told people about the poke salad thing, right? Poke salad is very tasty, but if you don't know how to prepare it, don't do it. It can be very toxic if not prepared correctly. It's the same thing with wild mushrooms. Don't just go out there picking, you know, wild mushrooms and eating them. It says right here, another elderly person has died from accidental mushroom poisoning at a California senior care facility, bringing the death toll to 4. The latest victim, 92-year-old Dorothy Mary Hart, died at a nursing home, according to the Associated Press. The date of her death has yet to be released. The first 2 women died the day after the caregiver at their senior care facility inadvertently served them a meal with poisonous mushrooms picked on the Loomis, California property November the 8th. The caregiver and 3 other residents of the Golden Age Villa were hospitalized, according to WTEN TV, the ABC News affiliate in Sacramento. Hart was among those to be hospitalized after the poisoning, but she was released and living in a nursing home. Teresa Alzavnik, 73, died the morning of November 9th, and Barbara Lopes, 86, died that night, according to the county coroner, Frank Warren Blodgett. 90, the third victim, died November the 17th. It looks like a tragic accident, Lieutenant Mark Reed of the Placer County Sheriff's Department said. Reed told the Sacramento Bee that the caregiver just didn't know the mushrooms were poisonous. It is not clear what kind of mushrooms the victims ate, however. Dr. Perry Golem, a liver specialist at the University Hospital in Cleveland, said he has seen an uptick in wild mushroom poisonings in his area. More than 24 patients have arrived in the past 3 years with telltale mushroom poisoning symptoms, he said, including diarrhea followed by kidney and liver failure. Golem, speaking to ABC News by phone from the meet of the American Association for the Study of Liver Disease in Boston earlier this month, said doctors there from across the country report similar increases in mushroom poisoning patients, even in areas not typically known for mushroom poisoning, such as the Midwest. Specialists historically see case clusters in Northern California and in the Northeast. Clearly, there is something that has changed in my mind that has led to more mushroom poisoning cases, he said. It looks like a nationwide phenomenon. The reason for the unclear, but Golem suggested that more people could be picking their own mushrooms in the bad economy to save money. Golem's hospital is one of the only few authorized by the federal government to give patients an antidote called psilocybin, which blocks the poison from attacking the liver. 14 patients have come from up to 150 miles away for the life-saving drug. The poison in these mushrooms is called amatoxin, and it is a colorless and odorless, so people who pick or eat them won't know until it's too late, Golem said. The poisoning fungi can also come in different sizes and shapes. Cooking or freezing the mushrooms does not deactivate the toxin. Typically, people begin to feel sick within 6 hours of eating the mushrooms and come down with severe diarrhea, which causes dehydration and kidney failure, he said. Without the antidote, liver failure can set in after 72 hours and then needs a liver transplant after 96 hours. I think at this point it is absolutely critical to spread the word, especially to folks that pick mushrooms, that the landscape has changed, Golem said. So basically, that poison, amatoxin, can cause liver failure and kidney failure and things. Hey, Rainwater Love. Yeah, so don't be eating stuff out your yard if you don't know what it is. Okay. Okay. And drugs are bad. Okay. No. Yeah, so I wouldn't be going out there picking mushrooms out of the yard. I wouldn't be going into the woods picking them unless you know how to identify them, because that's just like eating plants out of the yard, right? We know some plants are edible. Some plants are toxic unless prepared a certain way. If you do not know what you are doing, don't do it. Stick with your normal stuff that you do know how to prepare, because I don't want to see nobody unalive for doing something dumb as hell or accidental. You know what I'm saying? So don't be out there playing in the mushrooms trying to eat them motherfuckers. Not a cool look. But I do want to know how the Rise mushroom tea does with you, Mr. Buster. So when you decide to do that, please let me know how it worked for you, right? Because I really want to know myself. Does it make you feel better? Do you get more energy? I've heard some people say that. I'm going to have to look into it to see if it has any side effects or possible problems with liver dysfunction, blah, blah, blah. Because here's the thing. I'm very picky on what I add to or take away from myself. Very picky because of my liver condition. You had to woosah. You had to woosah. You had to go woosah. Don't let me smack these motherfuckers upside the head today. Woosah. Please, dear Lord, baby Jesus, give me the strength not to go smooth the fuck off today. I am begging you, please. Is that what you were saying in your head? I love them, Lord. Please let me not. Let my crazy not come out, dear Lord. They being some dumbasses today. Please, dear Lord, don't let me be a dumbass right back. Please do it, Lord. That's all I'm begging you. Yeah, you got to let me know. Time will tell. Time will tell. Tell me, after a couple of days, if it gives you a boost of energy, if it makes you feel better, so on and so forth. Because if it works good, I might want to try that shit. Because I've been like feeling real tired recently. So if y'all ain't seen me on the streets, because I'm most likely laying down, I just I believe um I believe that I am trying to go through the change early, but I'm taking the Depo-Provera shot. So I do believe it's like kind of stopping it a little bit, but at the same time, you know how when you're as a woman or a man, if your hormones start to dip lower, it makes you feel just real tired and different stuff. I believe that is trying to happen, but I'm not sure. I am 37 years old. I'll be 38 this year. My mom started going through it at 37. I'm not sure though, because she ended up having to have a partial, so it threw her into a partial hysterectomy early. So I'm not sure when I'm supposed to go through it, really, to tell you the truth. Oh, Rise is having a 1 month trial, half off sale, money back if not satisfied. That's good to know, Buster Buster. That's good to know for those who might want to try it. Let me go ahead right quick and go to their website. So it's coffee that helps boost energy, gut health, sharp focus, happiness booster, smooth and creamy like the flavor of latte, nutty aroma and robust flavor. It has 48 milligrams of caffeine, gluten free, 100% vegan, no sugar, no GMOs. It's for stamina. They have cordyceps. For focus, they have lion's mane. For mood, rachitia. For gut health, turkey tail. For immunity, shiitake mushrooms. For longevity, king trumpet. So it's supposed to help, and whatnot. Right now they have, Father's Day sale up to 40% off plus free gifts. I'm going to put their website into the box in case someone else decides they want to, click on it, and they want to try it for themselves. Never know. You pulled the daddy card, didn't you, baby shark? You pulled don't be no dumbass. Okay, for some reason I start thinking about who was that TV dad that goes dumbass and then pops him in the back of the head. Yeah, I don't know why, but I thought about that. Oh yeah, Red from that 70 show says dumbass, but then I'm also thinking of Michael Kyle where he pops in that show where he pops his son in the back of the head and the hook of the head when he's being stupid. I'm for some reason putting two different shows together at the same time. Don't ask, I don't know. I only have one, K-Fam, and thank God I don't have to deal with that. I can't imagine having more than one and having them doing some dumbass shit, because I might go around, I might pop them in the back of the head too. I swear to Jesus. But mine, the only thing I have to make sure he's doing is, are you alive? Did you take a shower today? Is your, like I don't have to work. He keeps his room pretty clean. I have to more and keeps his clothes and all that pretty nice and everything. The only thing I have to make sure of is that, he's still alive and breathing sometimes. Because sometimes my kid is just, he's a good kid. He really don't bother nothing. I just have to make sure he wiped, he took his shower today. Because he is a teen boy. And boys are notorious for that shit for some reason. I'd be like, did you take a shower? Did you wash your ass? All right. That's the only thing you got to do with teen boys. You got to make sure they wash their ass and they put deodorant on. For some reason, teen boys have that issue. I don't know what it is. Mine's doing pretty good on it, though, but I swear, if that's not a thing, I ain't sitting here. Now, with teen girls, you have to watch their little ass about being sneaky. You have to watch their little asses about being sneaky, trying to talk to boys and do dumb shit. But with teen boys, you have to make sure, you have to ask them if they wash their ass today. I don't know what it is now. teen girls are usually pretty good about, taking showers, taking care of themselves. The only thing you have to watch them about is sometimes they are a little messy in their rooms. But most of the time teen girls are take care of their body well and stuff. But for some reason teen boys you gotta stay on top of them about putting deodorant on and washing their ass sometimes. But I think I got pretty lucky because mine does it most of the time. So I think I got pretty lucky. But I want to know how that coffee or whatnot and stuff works. How that rise stuff works. Because I've heard people say it's good, but I've never tried it myself, kind of thing. They also they have different kinds. There's one called Beyond Brew, and there's something else. Let's see. I wonder if and it says there is also a mushroom drink versus black coffee. Um, Little to no caffeine in the mushroom drink, 96 caffeine in per cup, vitamin D to B12, potassium, selenium, antioxidants, and prebiotics are in the mushroom drink. In black coffee, it's vitamin B12, magnesium, and antioxidants. Mushroom drink says supports heart, brain, gut, and immune health, sustainable energy, and mental focus. Black coffee provides temporary energy and mental stimulation. They do, it says if your coffee alternative is only compromised of mushrooms and nothing else, it's most likely going to taste awful. Look for formulas that contain additional flavor enhancing ingredients that cover up the taste of mushrooms, like ginger or Keiko. Excessive caffeine. Many formulas contain doses of caffeine that exceed 40 milligrams, roughly half a cup of coffee. If you struggle with sleep, as so many do, it is in your best interest to avoid this much caffeine, especially in the afternoon. What else to consider? Comprehensive mushroom blends. Comprehensive mushroom blends with at least 5 different types of mushroom listed on the label. Real results take time. It is important to note that the dramatic changes to your health won't happen overnight. It can take months for significant events to take place. Month 3 is when many people report seeing a night and day difference in their energy levels. Seeing a night and day difference, immunity, digestion. So if you want the full effect of a coffee alternative, then stick with it for at least 3 months to feel the real results. Subscription plan. Coffee alternatives deliver their best results when used over time. Plus, when you find out one you love, you won't want to stop with the subscription plan. You won't have to worry about running out, and you'll get the best value. It's a money back guarantee, no questions asked. That's what it says on their website. And it says what else to consider. It shows their prices, what they have. There's Beyond Brew. There is the mushroom coffee by Rise. Beyond Brew, Live Conscious. MUD/WTR. It's, the pros. They showed the pros and cons. Mushroom coffee by Everyday Dose. Raza, original by Raza. They tell you the pros and cons. This website right here tells you the pros and cons of each different one. So I think that's pretty cool. You can look it up online. Here's that website if y'all want to look at it. It's pretty cool. I don't know why I posted it as 2 different comments, but oh well. Hopefully it works when you click on it. If your middle son didn't tell on your oldest son, tell your oldest son he wouldn't be alive right now. To be telling the tale. So thank God the middle son did what he did. Our oldest son may not be here right now. And I'm betting the only reason he told on his brother was because he knew it was dangerous. And he was trying to save his brother. You know what I'm saying? From doing some dumb shit. And thank God that middle son is smart enough to know that that was some dumb shit. If it hadn't been for the middle one being more thought process about it, the oldest one may not be here. So he better be thanking his middle brother for snitching. He actually may have saved his life. And that's probably the only reason he told, was because he knew that it was a possibility that his brother may not make it. You know what I'm saying? If he didn't tell. But yeah, I would say do your research on anything that you ended up deciding to do in life. If you decide to take any kind of, medication of any kind, whether it be vitamins or anything, please check and make sure it's good for you. Check with your doctor. Check with your, y'all, hold on. My dogs are going crazy. Give me just a minute. Come here, Bruiser. It's not the end of the world, Brew. There he goes. I swear, Brew thinks it's the end of the world sometimes. But I'm going to go ahead and get off here, and I will see y'all on these streets. I'm going to go take care of some things. I might be back a little bit later. I don't know. I might. Not sure. I know tomorrow my time's going to be a little off center. So tomorrow my son has a dental appointment. So we got to go take care of that. And so I may not stream at my normal time tomorrow. Just saying. If you don't see me in the morning, you'll know why if you were here. But huggies, beautiful peoples. I will see y'all later. Bye.
I'm from the TUPELO. I'm breaking my hood, so love I'm gon' show from the TUPELO. I'm breaking my hood to the day that I go from the TUPELO. I'm ripping my hood, so love I'm gon' show from the TUPELO. I'm ripping my hood to the day that I go.
I'm from the west side, we don't need no introduction, this was the best ride. We all big boy rolling and holding, come take a test drive. Hilldale, Evergreen, Glenkirk, Outer Street, bending every corner on the west, and that's where I'll be. Sunroof back, Captain C banging down 1800, chunking up the deuce to my post slanging down on 1800. Show no love to the ladies that's training round on 1800, making time stand still, crystalline swinging down on 1800. Watching out for them knuckleheads that be staying round on 1800. Big rims and low pros be blanging round on 1800. Better completely change the way you're thinking about around 1800. Really hate to see you boys get left slanking around 1800. Out of street got some history, just let Captain C lay it out. If I don't finish it all on this one, let the second verse break it out. Remember the blue apartments from OG standing back there by 60 deep. Bull walking, Charles Blue, a big Anthony using Pee.
I'm from the TUPELO. I'm breaking my